Nervous about your first visit to Dublin Dental Care? Good thing it's Dental Hygiene Wednesday. Hi, I'm Christina. I'm the lead hygienist here at Dublin Dental Care, and I want to welcome you to our Dental Hygiene Wednesdays. Every week we like to do a different video about either a product that we offer here at Dublin Dental Care or a topic that we feel is important to our viewers and our patients to know about so they can keep their mouths nice and healthy. Last week we did a dental hygiene minute, so if you missed that, feel free to check that out. This week we are talking about what to expect your first time coming to visit us here at Dublin Dental Care and what all is involved with that appointment. So when you do schedule your first visit here, it is going to be a longer appointment. They tend to be about an hour and a half, but that is so that we have the time to make sure that we're getting to know you a little better and that we're able to get the information we need to make sure that we're taking care of your needs as best as possible. When you first come in, we'll start your visit off with a tour of our office and show you the different types of stuff we have here at the office, types of x-rays, where the bathroom is, things that we offer to help you feel comfortable when you're coming in to get your teeth cleaned. Once we get that taken care of, we'll bring you back to the room, your hygienist will, and we'll get to know you a little better, talk about where you're from, things about you, so it's more than just me coming in to clean your teeth. We do care about our patients, so we want them to feel like family here, so we take the time to get to know them. Once we've talked for a little bit, we'll start a questionnaire, and this questionnaire is done so that we know what type of information you like, whether you like a lot of details or not a lot of details, and kind of a little bit of your dental past so we know, maybe some areas you've had trouble with or some bad experiences you've had, so we know that we should maybe take a little extra time in those areas if that's something we're doing. Once we've done that, we will take some regular pictures of you and your teeth, and that is just so we have those to look back on. If we feel like something's changing, we can just pull those up and kind of compare. And then we will move into taking x-rays, and this is so that we can check your teeth in between and at the roots of the teeth to make sure there's nothing going on that your hygienist or Dr. Pignano cannot see just by looking in your mouth. We want to make sure we're not missing anything and that your mouth is being taken care of as best as possible on our end. Once we get those x-rays taken, then we will chart any restorations or fillings that you've had done or crowns in the past so that what is going on in your mouth matches our charts here. And then we'll also measure your tissues to make sure that they're nice and healthy. And the importance of this is that every patient is different. Nobody has the same mouth. So we're making sure that we're treating your mouth for what's going on, whether it be a healthy mouth or whether you have periodontal disease, which is a very common disease among adults in the United States. So we want to make sure that we're treating you for your specific needs. Once we figure that out, we'll either go through with the cleaning if you have a nice healthy mouth and we're happy with the readings that we're seeing, or if we do find some deeper readings, we'll recommend doing a different type of cleaning, which we'll talk to you about in detail and make sure that you don't have any questions about that before proceeding. After getting all that information, getting the cleaning done, or talking to you about the treatment that's needed for your mouth, then Dr. Pignano will come in, he'll take a look at your medical history and get to know you a little bit, and then take a look at all that information that we gathered throughout that appointment and check your mouth and make sure that there's nothing going on that needs treated from his end. Once we're done, we will get you scheduled for any type of treatment you may need. If no treatment's needed, that's awesome. We'll schedule you for your next cleaning and we'll walk you up front and see you again in 6 months or sooner if need be. But we love having new people come in. We love getting to know everybody, and we hope that you choose to come into our office if you're not a current patient. I want to thank you for joining us today. I always look forward to doing these and giving my viewers and my patients information. If you have any questions for me, you can email me at dublindentalcareohio.com. Feel free to check out any past videos that you may have missed. They're on both our YouTube page and also our Facebook page. We love seeing comments from you guys, so leave comments if you have anything. We also love seeing your likes on those videos. It encourages us to keep doing these. So feel free to add any input you may have, and then also go check out our website. It's dublindentalcareohio.com. You can even schedule your first appointment to come in and see us from that website. So we look forward to seeing you, and we will give you a new video next week. Have a great rest of your week. Thank you.